Welcome back to What Veterans Want You to Know. We've partnered with military culture experts Psych Armor on this educational series so we at Kaiser Permanente can better serve veterans and their families. In this video, we'll discuss the important role we play as healthcare providers to support veterans affected by toxic exposure during military service.
New federal legislation has expanded access to benefits and care related to toxic exposure. Known as the Pact Act, this new law requires the U.S. Department of Veterans Affairs, or the VA, to provide health care to veterans with toxic exposures along with veterans of the Vietnam and Gulf Wars and post-9/11 era.
As healthcare providers, we're in a unique position to identify veterans who might qualify for these benefits and not even know it.
Under the new laws, the VA is required to provide free toxic exposure screening to all veterans. There are a few steps that you can take to determine if screening is appropriate for your patient. First, ask if your patient is aware of exposure to any of the following while serving: open burn pits and other airborne hazards, Gulf War-related exposures, Agent Orange, radiation, or contaminated water.
Next, ask your veteran patient where they served. Certain areas of military deployment are linked to toxic exposure. For post-9/11 veterans, these include Iraq and Afghanistan, as well as other locations in the Middle East and their surrounding waterways. Camp Lejeune in North Carolina is linked to toxic exposure due to contaminated water. Vietnam War era veterans who were born prior to 1960 are at risk if they served in Vietnam, Thailand, Laos, Guam, Cambodia, or the Johnston Atoll.
Lastly, be aware there are a number of medical diagnoses and symptoms that suggest toxic exposure during military service. These include a history of cancer in the brain or head, gastrointestinal, kidney, neck, pancreatic, reproductive, or respiratory cancers, as well as glioblastoma, melanoma, and lymphoma. Also linked to toxic exposure are asthma, chronic obstructive pulmonary disease, rhinitis or sinusitis, emphysema, pleuritis, pulmonary fibrosis, sarcoidosis, and other lung conditions. Finally, conditions seen among Vietnam War era veterans exposed to Agent Orange include hypertension and monoclonal gammopathy.
If you or your patient suspect they may be affected by toxic exposure, refer them to the nearest VA facility for a free toxic exposure screening. Every veteran enrolled in VA healthcare will receive an initial screening and follow-up at least once every 5 years. If your patient is not enrolled, they will be able to enroll and receive a free screening. The VA will inform them of any benefits, registry exams, and clinical resources they qualify for.
At Kaiser Permanente, we're dedicated to providing exceptional health care to all our patients, including those who served in uniform and their families.
Knowing how to advocate for your veteran patients affected by toxic exposure fulfills our promise to care for them as their service cared for us.